sharing survivor stories. Sister Circle NC will host a breast cancer awareness bruncheon. It's on Saturday, October 25th in downtown New Bern. Tammy West is here today along with Meredith. Tell us your last name, Meredith.
Garman.
Meredith Garman is here as well. Tammy, we want to talk about this nonprofit. What's the mission? Why did you start it or help to start it?
Yes, Sister Circle is a local nonprofit. We're grassroots. We started here in New Bern, North Carolina. Basically, we as a group, we saw that there were gaps in the community in regards to education, resources, awareness regarding pertinent health issues such as breast cancer, regarding food insecurities, and we just like to fill whatever gaps we can in the community.
And so in filling those gaps, what do you find is missing? What is an essential thing? We know transportation can be an issue, gift cards, but what do you find with your group?
What we're finding is a lack of, there are resources out there, however, many people in the community aren't aware of them. I myself, I'm a licensed clinical social worker. Meredith is a registered nurse.
Yes.
And to collaboratively as a group, we have law enforcement and we also have other professionals in human resources. So while we're out in the community, we come across various resources that the public may not be aware of. And what we found was that people were reaching out to me for certain things in the community, whereas Meredith and as a group, we would meet together and say, hey, I have someone that's in need of food, or we have someone that's in need of a ramp at their house, or we have someone, you know, they're elderly and they may need a ride to medical appointments.
Yes.
And so we, as a group, are able to kind of case manage in a sense, but I don't want to call it case management.
Individual cases, because it may be different
for each person. But we fill those gaps, whereas, you know, a lot of times people aren't, they may not be connected to social services, or they may not want to be connected to social services. We can kind of bridge them and be that support for them in the community.
I like that, and then with the name being Sister Circle, you see how that circle becomes complete.
Yes.
Great focus there. Meredith, when it comes to the nursing part of this, you being a caregiver, a care provider,
Yes.
what are you finding that breast cancer survivors or someone just going through the treatment phase needs from your standpoint?
They need education. A lot of people need education and resources as far as getting to their appointments, their chemo, different things like that. So we help to facilitate that.
So being a part of this group, you get to help in a different way as well.
Yes.
At the hospital, when you're seeing these patients and you kind of love on them,
Yes.
I imagine that is cathartic for you as
Yes.
well. So talk to us about that and how you release and relate with them.
It helps to provide the love, compassion that they need. Sometimes the family members, it may just not be the patient, but the family members need the compassion, the love, the understanding, the caring. So we help with that as well.
To know that they're not alone. And Tammy, also, it's a good time to share with everyone. You are a breast cancer survivor, diagnosed pretty young age. Tell us about your story.
Yes, I was 35 years old when I was diagnosed, which isn't usually typical. They recommend mammograms starting at 40. But in my case, it wasn't a lump that I noticed. It was another symptom could be an unusual discharge.
Yes.
And, hadn't it been for awareness of that by attending previous cancer events and receiving education, I wouldn't have known to follow up my PCP to just, make them aware of this concern that I had. And thankfully, that early detection saved my life. Because had I ignored it, my provider told me we would have been having a different conversation down the road.
Yes.
What stage was it when they found
They
it?
caught mine stage 1.
Which is great.
Yeah.
Tell us about the treatments you went through.
So because we caught mine early, I was also able to be included in some research to see whether or not I needed traditional chemo. Thankfully, my lymphs were clear, so my protocol was letrozole and quarterly injections to just address my estrogen. Estrogen was causing my, that was the
cancer.
Yeah, the cancer
Yes.
growth. So they had to, shut down my ovaries temporarily. But I am now it'll be 10 years next year. So I'm thankful for that. And we just want to spread awareness in regards to, early detection, knowing the signs. And that's a big part of our event that's coming up.
This is great. Did you go through a mastectomy as well?
Yes. Initially I started off with the lumpectomies. I had 2 lumpectomies. And during that time, they discovered cancer in my other breast. And so with that new information, I felt the best option was to pursue a double mastectomy. Yeah.
And here you are a decade later,
Yes.
strong,
Yes.
shining, and healed. So
Yes.
we are so proud of you, and
We
that
are.
you're also
Thank you.
stepping up to help other women. And Meredith, when it comes to that help, is that what drew you to Sister Circle?
Yes, ma'am, it is.
Tell us about that.
Well, my sisters and I, the Sister Circle group, we have a passion for giving. We just love to help. Anytime there's a need, we have always been there to jump in and help. So we have come, breast cancer awareness is strong on our heart because of some of our members, some of our close family members, friends, and people in the community. So we love to jump in and help as far as that.
And of course, you get to wear pink too.
Yes, yes, yes.
Spread awareness and be part of a family. That's what Sister Circle is all about. Here you see over my shoulder, this is some video. I emceed your brunch year before last in 2023. We heard emotional stories,
Yes.
not a dry eye in the building. Hundreds
Yes,
of people
yes.
there. Men were there
Yes.
as well. Everyone wearing their pink. So this brings us to this year's celebration. What do you have planned, Tammy?
All right, so this year's celebration will be Saturday, October the 25th at the Harrison Center in the historic New Bern, North Carolina. We're having a bruncheon this year. Our theme is Enchanted Garden. Every year we try to have a theme. And this year we'll be also bringing awareness, education, laughter, fun, silent auctions, great food, and entertainment. So we
It's
hope.
going to be excellent. Will we bring the fashion show back this year? too?
Yes, for the men.
Yeah, we might add some of the ladies in there because the ladies, they were looking good. We might.
It was great though to see those men get up with their pink socks, pink ties. I think somebody even had on a pink suit, maybe
Yes.
a
Yes.
pink shirt. So the men are involved as well because, as we know, some men will also be diagnosed with breast cancer
Yes.
this year and pretty much every year. Early detection is key. Spreading awareness, talking to loved ones, even girls at a young age, just
Yes.
letting them know, hey, if you feel something different, if you see
Yes.
something different, speak up, talk to your care provider, see if any tests are needed, and go from there. We will also want to let people know, Meredith, there is hope.
Yes, there is hope. Early detection saves lives. If you get your yearly exam, that is wonderful. Mammogram, please, ladies, get your mammogram. Keep on top of things. Men as well, if you have any symptoms, please get checked. See your doctor. It will save your life.
It will. That's the key word there. And so we're inviting you to attend the bruncheon Saturday, October 25th at the Harrison Center on Middle Street in New Bern. It's from 2 to 5 in the evening. And also, what about the tickets? Are tickets still available?
Yes, we still have a few tickets available on Eventbrite. You just look up Sister Circle NC on Eventbrite. You may also be able to scan the Q code that you see on the flyer that will be posted.
There it is, right there. So the QR code, we've made it easy for you. You can register, show up, enjoy yourself, wear your pink, and be in good company, and also the delicious food that will be there. Also, how can people contact you if they want to become a member of Sister Circle or volunteer, be a speaker, support in any way?
Right. The best way to contact us is through our email, which is sistercirclenc@gmail.com.
All right, ladies, thank you so much.
Thank you.
It's going to be a wonderful time, and to also continue to spread the awareness. Now, Breast Cancer Awareness Month is October, but this mission lives year-round. Keep that in mind.
Yes.
I'm Valentina Wilson in your community.